opening up the computer. Hey y'all, hey. Letting y'all come into the room. What's up, what's up? Happy Thursday, happy Thursday. Okay, y'all have definitely saved the night. Y'all are the MVPs. Y'all are the goats, the lambs, the horses, the cat. I don't know. I love you. That's all I know. Y'all are the goats. Thank you so much for your recommendations and like about all the nausea stuff. I had no idea about Prego Pops. I've never been pregnant, never gonna be pregnant. So I ordered that swiftly. It'll be here tomorrow, okay? So I'm excited to just be starting to feel better. And as you can see, got one of these little patches, trying to make it through, okay? But I just want to come on. Of course, it is Thursday, so you know what? It's NCLEX Jeopardy time. NCLEX Jeopardy time. How y'all doing? Y'all got y'all gummies. Awesome, awesome. There was some issues with some people not getting their second bottle. So if you ordered 2 bottles and you only got one, the second one's on its way. Yeah, it was like returned, but it's fine. It's already been sent out, so it should be on its way to you guys. But I'm so glad the study gummies are helping you. Somebody said that the study gummies, they took the study gummies and passed the exit HESI second attempt. Awesome. There is about 1,500 milligrams of lion's mane inside of those gummies, and you take 1 to 2 right before you study or right before you do anything that requires mental clarity, focus, motivation, and it kind of like jump starts you into doing that. So awesome that you guys got your gummies. Jolly Ranchers, sucking some hard candy. Okay, will do. Yeah, the spiciness is from the lion's mane. That's just the taste of the mushroom. But it's a strawberry flavor, but the little spice, almost like I call it like a cinnamony, like little spice to it. But once again, that's just the taste of the mushroom. It quickly dissipates, and it has the strawberry flavor to kind of mask it. But the little spiciness, that's normal, okay? That's just it telling you that it's working. It's motivating you, getting y'all spiced up, okay? So you guys know we are here for our NCLEX Jeopardy. So let's go and bring it up. How y'all doing today? Please put in the comments how your Thursday is going. Happy holidays. Okay, let's do this one. How y'all doing? Sometimes I was worried. Yeah, a lot of people was like, it's supposed to be a little spice to it. It is. It's the lion's mane. The gummies are the study gummies that I have. That helps with motivation, focus, mental clarity, and it's a really great herbal supplement for when you are about to study or need to really be on your A game as far as like your mental. All right, guys, here we go. All right, so we have our NCLEX Jeopardy. We have 5 categories. We have farm, fundamentals, mental health, maternity, and pediatrics today. Okay, you guys know, let me go ahead and go to the app. And I'm updating these questions so you guys can play along, either play along or play by yourself, play with some friends. If you want to play the mobile version from the Nurse Sam app, and go to NCLEX Jeopardy and play the mobile version of NCLEX Jeopardy on your phone, you can totally do that. I am about to pull up our game. All right, guys, let's see. How do I purchase? You can just go to the link in bio. It's Study Gummies. It's right there first on the page, or you can download the app. Awesome. Y'all are doing good. Okay, awesome. Y'all ready? So let's go ahead and start with maternity, since that seems to be the theme of today. All right, let's do maternity for 200. Let's just start, okay? All right, so as you guys know how we play NCLEX Jeopardy, I'm going to read the questions, I'm going to read the answer choices, and you guys are going to respond back in true Jeopardy style and say what is and then whatever the answer is going to be. So for, just like in NCLEX, your answer choices are going to be like 1, 2, 3, 4, or 5, whatever. So you're going to say what is 1, what is 2, what is whatever. Okay, so once again, I'm going to read the answers. I'm going to read the question and read the answers, and you guys are going to pick. Okay, all right, so first question, maternity for 200. Which statement reflects a new mother's understanding of the teaching about the prevention of newborn abduction? Which statement reflects a new mother's understanding of the teaching about the prevention of newborn abduction? Is it 1, I will place my baby's crib close to the door? Is it 2, some healthcare personnel won't have name badges? Is it 3, I will ask the nurse to attend to my infant if I'm napping and if my husband is not here? And 4, it's okay to allow the nurse assistant to carry my newborn to the nursery. Which of those statements, 1, 2, 3, or 4, reflects a new mother's understanding of the teaching about the prevention of newborn abduction? Okay, so we're looking for a statement that confirms that the new mother understands how to prevent newborn abduction. Okay, so we're looking for a statement that is agreeing. We're looking for a true statement. Okay, so 1 says, I will place my baby's crib close to the door. True or false? Is that something that's going to reflect understanding? 2 is, some healthcare personnel won't have name badges. 3 is, I will ask the nurse to attend to my infant if I'm napping and my husband is not here. And then 4 is, it's okay to allow the nurse assistant to carry my newborn to the nursery. Okay, you guys are saying, I'm seeing majority 2s, which is some healthcare personnel won't have name badges. Let's look and see what that answer is. All right, guys, some people are actually answering with 3s now, and the answer is actually, what is 3? So 3 says, I will ask the nurse to attend to my infant if I'm napping and my husband is not here. That is the correct answer. All right. It says, precautions to prevent infant abduction include placing a newborn's crib away from the door, transporting a newborn only in the crib and never carrying the newborn, expecting healthcare personnel to wear identification that is easily visible at all times, and ask the nurse to attend to the newborn if the mother is napping and no family member is available to watch the newborn. The newborn is never left unattended, okay? If the mother states that she will ask the nurse to watch the newborn while she is sleeping, she has understood the teaching, all right? So options 1, 2, and 4 are incorrect, and they also indicate that the mother will need further teaching. So once again, 3 is the correct answer, all right? Remember, we do not leave the newborn unattended ever, okay? Name badges needs to be clear. I need to see who you are, love. Front and center, okay? Healthcare personnel, they need to always have badges that is visible in sight, okay, at all times. Transporting a newborn, only transport in the crib versus in arms. That's how you prevent newborn abduction, okay? And then as far as placing the baby's crib close to the door, no, you wouldn't. As further away from the door as possible. Remember, we're trying to prevent abduction, not make it a little easier for them, okay? So this the door, this the baby. Door, baby, okay? All right. 3 is the correct answer once again. So great job, guys. That said 3. Who said 3? Let me see. Amazing Paris. Aja, Grinding for Grace, Kayla, LaBoss, Debbie, Brina, Kelly versus Kelly. Awesome job, guys. And Mrs. Rose. See you. Awesome job. Now, if you chose 2, it was probably, as someone said, it was the wording. But now we know. Remember, make sure that ID band is visible at all times. All right, so now let's do mental health. Let's do mental health. Okay, this is another one. All right, guys. So this question reads, this is mental health for 100 points. A client is preparing to attend a Gamblers Anonymous meeting for the first time. So GA, Gamblers Anonymous. The nurse should tell the client that which is the first step in the 12-step program. What is the first step in the 12-step program? Is it 1, admitting to having a problem? 2, substituting other activities for gambling? 3, stating that the gambling will be stopped? Or 4, discontinuing relationships with people who gamble? What is the first step in the 12-step program? I feel like this is like on every movie. Yeah, this is one of the questions where, like, honestly, like, the media, if I didn't know this for sure, it's just because I've heard it around somewhere. I was like, I always hear about these steps. These was first step. The first step is always admitting you have a problem. So what is 1? Great job. So it says the first step in the 12-step program is to admit that a problem exists. Okay, accountability. Substituting other activities for gambling may be a strategy, but it is not the first step. Okay, the remaining options are not realistic strategies for the initial step in a 12-step program. Remember, if you're going to seek help, you have to first acknowledge that you need help. Remember that, okay? So, great job. I think everyone pretty much got that one. Tahira, Nurse Lori, Brina, Kelly, Jamie, Jay, Kayla, Miss Lulu, Carla, Big Homie, Jameson, Labas, Wanda, Debbie, Rosalind, Aja, Jameson, period. Yes. All right, love it. Okay, that was really good, guys. But now let's shake it up, because y'all doing too well. let's really test that comprehension, okay? All right, now we're doing pharmacology for 500. Pharm 500. All right, it says the nurse is taking care of a client receiving oxybutynin. Oxybutynin. Which finding should the nurse expect to note if the client develops side or adverse reactions of this medication? Is it 1, itching, 2, diarrhea, 3, swelling, or 4, dry mouth? Hey sis, hey Unknown Beauty. Welcome, welcome. All right, guys, I just read the question and the answer choices. Let's read it again. Remember, this is Pharm for 500. All right, the nurse is taking care of a client receiving oxybutynin. Which finding should the nurse expect to note if the client develops side or adverse effects of this medication? Is it 1, itching, 2, diarrhea, 3, swelling, or 4, dry mouth? Which finding should the nurse expect to note if the client develops a side or adverse reaction to oxybutynin? Itching, diarrhea, swelling, or dry mouth? Let's look at what you guys are saying. I see a 1, a 3, a 1, a 3, a 1, a 4, a 1, a 1. So I'm seeing a lot of 1s, which is itching. Let's go ahead and look it up. All right, so it says the answer is 4. The answer is 4, guys. Great job, Big Homie, Kayla, Carly, Brina, Unknown Beauty. Great job. That was a good one. I want to know, and somebody said was Aja. She said it too. Grinding for Grace, San Diego. Let me know why you guys said dry mouth. Before I say the answer, let me know why you say dry mouth. Let me see if you get it. And I feel like I know why you guys say dry mouth. What kind of medication is oxybutynin? What type of medication is oxybutynin? And that's really going to answer the question. What type of medication, like what classification is oxybutynin? What type of drug is that? Put it in the comments. Put it in the comments. Come on. Yeah, what's the type of drug? Oxybutynin. What kind of drug is it? Thank you, Unknown Beauty. It's an anticholinergic. Thank you, Unknown Beauty. Great job. So yes, it's an anticholinergic, okay? Remember with anticholinergics, there are side effects. Dry mouth, constipation. Well, before we do that, remember with the side effects for anticholinergics, you can remember can't see, can't spit, can't shit, can't, wait, see, spit, shit. What's the other one? Can't pee. Can't pee, can't see, can't spit, can't shit. That's what it is. And can't pee is urinary incontinence. Urinary retention. Can't see is you have blurry vision. Can't spit, dry mouth. So that's why number 4 was correct. Can't spit. That is the side effect of anticleritics. It's one of the 4 main ones, okay? Can't see, can't pee, can't shit, can't spit. Can't see is blurry vision. Can't pee is urinary retention. Can't spit is dry mouth. And can't shit is constipation. I'm sorry for cursing, my bad, but y'all grown. So yes, once again, dry mouth, constipation, urinary retention, blurred vision, dry eyes. Those are the common on anticlinergic side effects, okay? So whenever you have a medication, that is so often like tested on the NCLEX, especially anticlinergics, and it's always like dry mouth for some reason. Yeah, yeah. Anyway, anticlinergics, remember those 4 side effects. Please write it down, do what you need to do. But yes, oxybutynin is an anticlinergic, okay? And dry mouth is one of the side effects or adverse effects that the nurse should expect to note, okay? Remember, these are side effects and adverse effects that the nurse should expect to note. That's why itching was not the correct answer. Obviously, well, I'm going to say obviously, but whenever you give somebody a new medication, whenever you give someone a medication, they're complaining of itching, there's a good chance that they're having some kind of allergic reaction to it. That is not, never will be expected, okay? It's never an expected finding. It's never an expected side effect. But for anticlinergics, those side effects are expected, which is why 4 was the answer. Right, exactly. All right, guys, great job with that one. Let's do fundies. Let's do fundies. A gastrectomy is performed on a client with gastric cancer. In the immediate post-operative period, the nurse notes bloody drainage from the nasogastric tube. The nurse should take which most appropriate action? 1, notify the surgeon. 2, measure abdominal girth. 3, irrigate the nasogastric tube. Or 4, continue to monitor the drainage. What is the most appropriate action if a nurse observes bloody drainage from the nasogastric tube immediately post-op a gastrectomy on a client? What's going to be the most appropriate action? 1, notify the surgeon. 2, measure abdominal girth. 3, irrigate the nasogastric tube. Or 4, continue to monitor the drainage. I'm going to read the scenario one more time. A gastrectomy is performed on a client with gastric cancer. In the immediate postoperative period, the nurse notes bloody drainage from the nasogastric tube. The nurse should take which most appropriate action? 1, notify the surgeon. 2, measure abdominal girth. 3, irrigate the nasogastric tube. Or 4, continue to monitor the drainage. All right. I'm seeing pretty much between 1s and 4s. 1 is notify the surgeon and 4 is continue to monitor the drainage. Okay. The answer is, what do you think? It's 4. Continue to monitor the drainage. Remember, guys, this is the immediate post-operative period. They just sliced and diced this client. It's gonna be some blood. It's gonna be some blood there. They just did it. It's the immediate post-operative period, guys. All right, so it says, following gastrectomy, drainage from the nasogastric tube is normally bloody for 24 hours post-operatively. It changes to brown tinge, then yellow, then clear. Now, because bloody drainage is expected in the immediate post-operative period, 24 hours, okay, within 24 hours, the nurse should continue to monitor the drainage. Remember, this is just a normal expected finding. They just got sliced and diced. Just got it, okay? So a little bit of bleeding, some bleeding is going to be normal within the first 24 hours. The nurse does not need to notify the surgeon at this time. Please don't. The surgeon's gonna be rude. They're gonna be rude to you. They're gonna be like, I know you're not, just call me 2 minutes after I just slice this man. Monitor it, okay? So we do not want to notify the surgeon at this time because it's not something that we need to notify them of. It's an expected finding, okay? Just monitor it for the next 24 hours and monitor the drainage, all right? Now, measuring the abdominal girth is performed to detect if there's some type of distension, okay? Following gastrectomy, a nasogastric tube should not be irrigated unless there are specific surgeon instructions to do so. Don't go rogue. Don't go rogue, okay? So it doesn't matter if you're an RN, LPN, Powerpuff Girl, do not irrigate that nasogastric tube following a gastrectomy unless the surgeon tells you, not even tells you, writes a prescription, and a specific prescription to do so, okay? All right, so once again, the answer is 4. Right. Thank you, JC98. Thank you. Can I pin this? Pin comment. Okay, I just did. She said, I've noticed with NCLEX style questions, they give you hints with keywords. Oh my gosh, this is why I keep telling you guys that practice is one of the best ways to really prepare for the NCLEX, especially if you give yourself enough time. Just naturally just practice taking the questions. You'll eventually notice, just like this person did, you'll notice a trend. You'll notice like certain things. Like she said, they give you hints with the keywords. Immediately was the one on this one. See, in the immediate post-operative period. That's why I always reread the question to you guys. I always say, I'll read it slow in your own words and make sure you are looking out for those keywords. The immediate post-operative period. That immediate post-operative period was what's going to let you know that, look, this just happened. So what are you expected to find versus what are you not expected to find? So make sure you are paying attention to how they're wording the questions because it can help you answer it, okay? Thank you, JC98. Someone said, how do I purchase the Ultimate Nursing School bundle? You can go to the link in my bio, go to nursehim.com. It is on sale for $25 versus $97. Remember, this is a digital version. But once you buy it, you will get the information. You get the links and the codes to print it if you want. Print it and spiral it if you want. It is optional, but I found the best, cheapest price as possible for you guys. Like I said, Office Depot and Staples tried to charge me over $200 for it. I found it for you guys for less than $90, about $85 if you use the code. Listen, to print in color and spiral bind 400 pages, 400 color pages for only $85, you can't beat that with the stick. Okay, because it's the paper, the material, the cost to print, the materials to bind, that costs money. So especially with 400 pages, it's usually like it costs you some cents per page to print. And if you're printing 400 pages, usually it's about 25 cents. That's already $100 right there. So I found it for you guys, I think for like 11 cents with my per page with my discount. So that is gonna be included with the purchase of the Ultimate Nursing School bundle. Like that information and that code to get that discounted price to print it if you feel you want to print it. You don't have to. It is a digital product. You can pull it up on any digital device, but you have the option to print it in its entirety, print specific pages if you want. That option is for you to use however you want, okay? But that option is given to you guys. Yep, it'll be in your email. It's actually in the email that's delivering the individual links. So the email is titled, Your Ultimate Nursing School Bundle is Here. That's what the email is titled. And that's delivering all the separate links. So just in case y'all don't want the 400-page bundle, but just in case you want to access certain study kits, it's 23 study kits inside the bundle, a total of 400 pages. But some people just like to print out specific study kits or specific pages. So that's why I give it to you guys in link form as well, just in case you want to access the individual study kits as well. So in that email, at the bottom of the email, you will see the link and discount code to order and print that bundle. And if for some reason Give me a thumbs up if you can hear me. Thumbs down if you can't. Can you hear me? Can you hear me? If y'all can hear me, I'm about to do the can we talk for a minute? Girl, I want to know your name. I was low-key hoping y'all would not hear me do that challenge. So glad y'all can hear me. I'm gonna stop singing. Let's get back to it. All right, so let's go back to our pediatrics. All right, guys, we're gonna do peds for 300 points. I can slick low-key sing for real, but not anymore. All right, so the question for right now is pediatrics for 300, all right? It says the daycare nurse is observing a 2-year-old child and suspects that the child may have strabismus. Which observation made by the nurse indicates the presence of this condition? Sorry, I was reading it because I was like, what is the answer? Sorry. 1, the child has difficulty hearing. 2, the child consistently tilts the head to see. 3, the child does not respond when spoken to. Or 4, the child consistently turns the head to hear. Huh? I'm sorry, what? No. All right, so once again, the daycare nurse is observing a 2-year-old child and suspects that the child may have strabismus. Strabismus. Which observation made by the nurse indicates the presence of this condition? Is it 1, the child has difficulty hearing? 2, this is really funny. This is really funny. I can't wait to go over this with y'all. 1, the child has difficulty hearing. 2, the child consistently tilts the head to see. 3, the child does not respond when spoken to. Or 4, the child consistently turns the head to hear. What is the answer? I see 2. Everyone's pretty much saying 2. Do y'all notice a pattern with options 1, 3, and 4? Thank you. Oh my God. Unknown Beauty. Thank you so much. You always have my back. Always have my back. Thank you, Unknown Beauty. Yes. 1, 3, and 4 are the same thing. 1, 3, and 4 lets us know the child cannot hear. Okay. 1 says the child has difficulty hearing. 3 says the child does not respond when spoken to, which means the child has difficulty hearing. And then 4 says the child consistently turns the head to hear, which means they're having difficulty hearing. So 1, 3, and 4 are all the same. And 2 is the only one that has something to do with seeing. So let's just say we don't know what the hell strabismus is. I don't know what the hell that is. But 1, 3, and 4 said the same thing, love. You're not going to get me. You're not going to get me. Cute, NCLEX. Very cute. Very cute. But I see past your games. Play stupid games and get stupid prizes. The answer is 2, y'all. Strabismus is a condition in which the eyes are not aligned because of lack of coordination of the extraocular muscles. The nurse may suspect, oh, I almost fell. The nurse may suspect strabismus in a child when the child complains of frequent headaches, squints, or tilts the head to see. Other manifestations include cross eye, closing one eye to see, diplopia, which is double vision, photophobia, which is fear of light, loss of binocular vision, or impairment of depth perception. All that got everything to do with sight and vision and seeing. So once again, options 1, 3, and 4 have nothing to do with sight and everything to do with hearing. So just based off of our process of elimination, I'm just going to go ahead and guess what the answer is 2. Let's look and see if it is. Oh, wait, it is. Let me see what y'all are saying. JC said they want that baby. They want that poor baby to not hear so bad. Poor baby had difficulty hearing, didn't respond when spoken to, consistently turned the head to hear. Jeez. They want you to hear so badly, not to hear so badly. That's funny. That's funny. All right, guys. Y'all are funny. All right, let's do another one. All right. Where y'all want to go? Farm, fundies, mental health, maternity, or pediatrics? Where do I want to go? What are y'all saying? Y'all not telling me nothing. Let's do maternity for 400. Okay. The nurse is preparing to instruct a client on how to bathe a newborn. Which statement should the nurse include in the instruction? 1, begin with the eyes and face. 2, begin with the feet and work upward. 3, do the back first and then the front side. Or 4, start and say it with your chest. And didn't say it. Start with your chest, move to the face, and then finish the rest of the body. Okay, so what are the instructions on how to properly bathe newborn? Side note, maybe this is just me not having kids. I didn't know there was a proper way to bathe a newborn. You learn something new every day. I actually don't know the answer to this question. So, what y'all saying? One says begin with the eyes and face. I feel like in the movies, that's pretty much, they start here. I don't know. Begin with the feet and work upward. I feel like beginning with the feet would like make it cold and they'll lose. I don't know. What is the answer? 1, begin with the eyes and face. 2, begin with the feet and work upward. 3, do the back side first and then the front side. 4, start with your chest and say it with your chest. Move to the face and then move to the rest of the body. What is the answer? Y'all are saying 1. Y'all saying 1 because y'all got kids, or y'all saying 1 because y'all really know? So the answer is 1. So good job. So the answer is 1, begin with the eyes and the face. It says bathing should start at the eyes and face, usually the cleanest area. Next, the external ear. Oh, Lord, we're just going to place to place. So we start with the eyes and the face because it's usually the cleanest area. And then we're going to move to the external ear and the area behind the ears. Okay. Then you're going to go with the newborn's neck. Okay. Because formula, lint, or breast milk will often accumulate in the folds of the neck. Didn't know that. Hands and arms are then washed. And then the newborn's legs are washed next. So it sounds like they're going actually top down instead of upward, working upward, which is the opposite of number 2. So that's why number 2 is not out. Not correct. Then it says the newborn's legs are washed next and the diaper area is washed last. So it looks like the proper way to bathe the newborn is from the cleanest area to the least cleanest area and from the top to the bottom. Am I correct? I'm not sure. Let me know. So y'all just know how to bathe newborns. Good job. Awesome. Yeah, I had no idea. So yes, that is the correct answer, number 1. So awesome job, guys. Great. Super proud for y'all knowing without even having kids. Look at y'all. So proud. I just think of not the rest of the body on the face. That's true. That's true. You don't want to clean the baby ass and then go to the face. That is disrespectful. Oh my God. Okay. All right, next question. We're going to go. Let's do farm. Do farm for 100. It says, the camp nurse asked the children preparing to swim in the lake if they applied sunscreen. The nurse reminds the children that chemical sunscreens are most effective when applied at which times. Side note, do y'all like swimming in lakes? Or any body of water that is not see-through? Let me know. Once again, the nurse reminds the children that chemical sunscreens are most effective when applied at which times. Is it 1, immediately before swimming? 2, 5 minutes before exposure to the sun? 3, immediately before exposure to the sun? Or 4, at least 30 minutes before exposure to the sun? Let's go over those answer choices again, because I see a trend. 1 says immediately before swimming. 2 says 5 minutes before exposure to the sun. 3 says immediately before exposure to the sun. And then 4 says at least 30 minutes before exposure to the sun. Okay, so what is our answer going to be? Y'all are saying 4, which is at least 30 minutes before exposure to the sun. And y'all are correct because y'all are awesome and gonna kill the NCLEX. So rest in peace. Sunscreens are most effective when applied at least 30 minutes before exposure to the sun so that they can penetrate the skin. All sunscreen should be reapplied after swimming or sweating because it literally just washed off. Okay, so yes, great job, guys. 4 is the correct answer. At least 30 minutes before exposure to the sun, giving you enough time to penetrate into our pores, okay, and penetrate the skin so we are protected from the sun. I just think it's funny that the only one that said that didn't have exposure to the sun was number 1. It just said immediately before swimming. Like, it's called sunscreen, not swim screen. Okay. Now, great job, guys. Let's do mental health for 300. Okay, it says a client experiencing disturbed thought processes believes that his food is being poisoned. Which communication technique should the nurse use to encourage the client to eat? 1, using open-ended questions in silence. 2, sharing personal preferences regarding food choices. 3, documenting reasons why the client does not want to eat. Or 4, offering opinions about the necessity of adequate nutrition. What is our answer? I'll read it again. Okay, remember, this is mental health for 300. It says the client experiencing disturbed thought processes believes that his food is being poisoned. By who? I don't know, but they're believing it. Which communication technique should the nurse use to encourage the client to eat? Remember, the client believes that their food is being poisoned. If you think your food is being poisoned, you're not going to eat that food. Okay? Period. So what can we do? What can we say? What communication technique can we use as the nurse to encourage this client to eat? 1 says using open-ended questions in silence. 2, sharing personal preferences regarding food choices. 3, documenting reasons why the client does not want to eat. Or 4, offering opinions about the necessity of adequate nutrition. Y'all are all saying 1. So let's go ahead and see if that's the answer. And it is. The answer is, what is 1? It says open-ended questions in silence are strategies used to encourage clients to discuss their problems. It says sharing personal food preferences is not a client-centered intervention. You're literally just telling them what you like. They're saying, hey, I think my food's poisoned, and you're just going to be like, well, I like Chipotle. Negative. It says the remaining options are not helpful to the client because they do not encourage the client to express their feelings. The nurse should not offer opinions and should encourage the client to identify the reasons for the behavior. Okay? So, yes, what is 1 is the correct answer. Since I just finished my psych clinical rotation, and woo, baby, some of them really do. Whoo-wee. Listen, I live in Georgia, and when I did my psych, like in the Atlanta area, when I did my psych rotation, we went to a psych hospital called Floyd Hospital. Do I have any nurses in Georgia that did clinical psych rotation at Floyd Hospital? Please let me know. We'll talk. All right, so let's go to our next question. But yes, a number they really do be like that. I am not going for my RN. Y'all see what y'all going through? I am good right here helping y'all. No shade, but I make more than y'all. I'm good here, love. I'm good here in my little LPN play nurse role, making my coins and staying home, okay? I'm good. Thank you, though. All right. But I'm here to help y'all become RNs, though. totally for it. Hey, I'm not against it. It's just not for me. It's just not for me. For you, have at it. Have at it, boo. I'm here to help you. That's what we're doing NCLEX Jeopardy. But I'm not doing it. I'm gonna pass. Best of luck to you. Mwah. I'm good. Okay? And I mean that wholeheartedly. I'm Gucci with my little practical nurse, my LPN. I am fine with it, baby. All right, let's do peds again for 400. All right, so it says, a 7-year-old child is seen in the clinic and the primary healthcare provider documents a diagnosis of primary nocturnal enuresis. Primary nocturnal enuresis. The nurse should provide which information to the parents? So remember we said, look out for those keywords, look out for those diagnoses. Let's see if we know what the question's asking based off of what the question's asking, based off of the text in the question, okay? So once again, we know this is peds, so them saying a 7-year-old child is seen in the clinic, no shit, it's peds. And the primary healthcare provider documents a diagnosis of primary nocturnal enuresis. Y'all know what that means? What does that mean in layman's terms? Put it in the comments. The nurse should provide which information to the parents? Okay, I'm gonna read the question. I'm gonna read the answer choices. But in the meantime, let me know what primary nocturnal enuresis means in layman's terms. Thank you, Mulamar, bedwetting. So sorry. At night. That's what the nocturnal part means. So 1 says primary nocturnal enuresis does not respond to treatment. 2, primary nocturnal enuresis is caused by a psychiatric problem. 3 is primary nocturnal enuresis requires surgical intervention to improve the problem. Or primary nocturnal enuresis is usually outgrown without therapeutic intervention. Okay, so which of these is accurate in regarding the diagnosis of primary nocturnal enuresis? What information would be accurately given to the parents? Y'all are saying I don't know why peeing the bed specifically sent me. Everybody else said wet the bed, bedwetting. Someone said pee the bed. I'm sorry. That was funny to me. Oh Lord, that sent me. Okay, so everyone's saying 4, which is the last one. And that is the correct answer. Good job, guys. Who got that? Miss Lulu, Brina, Aya, Miss Fabulous, Amazing Paris, Nay, Unknown Beauty, Wooey. Great job, guys. All right, so it says the primary nocturnal enuresis occurs in a child who has never been dry at night for extended periods, okay? So I really wanted you guys to, because y'all said bedwetting, but I wanted to make sure you said bedwetting at night, okay? Because it's not just enuresis, that nocturnal part, and that at night part is very important. So yeah, the condition is common in children, and most children eventually outgrow bedwetting, not pee in the bed. Y'all don't say that to the parents. Don't say, look, y'all, your kid pisses the bed. Say bedwetting. All right, so it says most children eventually outgrow bedwetting without therapeutic intervention. The child is unable to sense a full bladder and does not awaken to void. The child may have a delayed maturation of the central nervous system. Sometimes you just don't feel that shit, okay? The condition is not caused by a psychiatric problem. Once again, it may be a delayed maturation of the central nervous system. So they don't need to go to the psych. They don't need to go to therapy, try to figure out mentally what's wrong with them, why they keep wetting the bed, not pissing the bed. But yeah, it's not caused by a psychiatric problem. It could be caused by that delayed maturation of the central nervous system. And once again, if you're sleeping, especially if you have that delayed response or that delayed sensation of a full bladder, the child usually will not awaken to void, and that's just what happens. It just is what it is. But the good thing is that it usually doesn't require any type of intervention besides just time, and yeah, usually they just outgrow it. Okay, so the best thing with that is just to give them lots of encouragement, and so they don't feel like there's something wrong with them. They don't feel like embarrassed. You know, so it's a lot of making sure that they know that there's nothing wrong with them and that's something they can outgrow. Okay. I'm not dealing with you. I'm not doing this with you. She said, but you know those dreams when you think you're using the bathroom and you actually see them. Has that happened to y'all? Tell the truth. Tell the truth. It's closely happened. Don't lie. But man, them dreams, would it be like you peeing in the dream and just like in real life? I don't know if it's gonna happen. I don't know. But yes. I'm not doing this with you. Let me see what that was, y'all. Carly said, I hope my child doesn't pee the bed. Y'all are sending me. I can't. Ooh. Whew. Look, y'all will make me throw up from laughing so hard. Please stop. I just got this on. All right, let's do another one. Okay, let's do fundamentals for 400. All right, so a client is about to undergo a lumbar puncture. The nurse describes to the client that which position will be used for or during the procedure. 1, side lying with the pillow under the hip. 2, prone with the pillow under the abdomen. 3, prone in slight Trendelenburg position. Or 4, side lying with the legs pulled up and the head bent down onto the chest. You always got to make the studying fun. That's literally why I study the way I study. When I was in middle school, all we did was literally laugh the entire time that we were studying. I made everything like a joke. It was so funny. But yeah, y'all are saying the last one, 4 for 4. And that is the correct answer. It is what is 4. Someone said I missed the circumstance. I'm going to read it again. Clients about to undergo a lumbar puncture. That's the procedure that they are about to undergo. So the position that they're going to be in during that procedure is going to be number 4, which is side lying. Hold on, let me pretend I'm lying down. Side lying with the legs pulled up. Legs pulled up. Hold on, I'm in the chair. And the head bent down onto the chest. So it's like this. Wait, where are my hands? Side lying, legs pulled up, and the head bent down to the chest. Okay, so that's going to be our position. Y'all see me? That's going to be our position for our lumbar puncture. And it says a client undergoing lumbar puncture is positioned lying on the side with the legs pulled up to the abdomen and the head bent down onto the chest. The position helps open the spaces between the vertebrae and allows. Can you hear me still? I'm not doing Can We Talk? I'm not doing Can We Talk? Let me see. Okay. All right. Where was I? Make sure y'all can still hear me. Thumbs up if you can still hear. And then I'm going to finish my explanation. Make sure y'all can still hear me. Give me a thumbs uppity ups. Okay, awesome. So once again, remember for our client undergoing a lumbar puncture, okay? The side line with the legs pulled up and the head bent down, it's specifically that way. And I want to show it to you guys. Hold on, wait. It's hard to lay down up. Okay, so that's kind of gonna be how our back is. It's like it's a little bit of an arch. And what that is that the position is opening up the spaces between the vertebrae and allows for that needle placement to be easier. The nurse remains with the client during the procedure to help the client maintain this very uncomfortable position that I just showed y'all. The other options identify incorrect positions for this procedure, mostly because they do not open up that vertebrae, which would definitely allow for easier needle placement. Okay, lateral I'm not doing this with y'all. because y'all are about to kill the NCLEX, and I feel bad for it. I feel so bad for it. I'm about to plan its funeral. All right, so lateral recumbent position. Yes, ma'am, that is what it's called. All right, perfect. Let's go to our next one. Okay, now let's leave it. Let's leave it with some farm. Let's end it on a farm note. All right, guys, last question, and then I'll put all the remaining questions immediately on the app. All right, says the nurse is providing instructions to the client newly diagnosed with diabetes mellitus who has been prescribed pramlintide. What? Hold on. This is one of the ones y'all. I'm just gonna show y'all. Okay. Yeah. That word. All right. So the nurse is providing instructions to the client newly diagnosed with diabetes mellitus who has been prescribed pramlintide. Oh, hell. This word. Shit. Which instructions should the nurse include in the discharge teaching? 1. Inject the pramlintide at the same time you take the other medications. 2. Take your prescribed pills 1 hour before or 2 hours after the injection. 3. Be sure to take the pramlintide with food so you don't upset your stomach. And then 4, make sure you take your pramlintide immediately after you eat so you don't experience a low blood sugar. What is our answer? And I'm showing this to you guys, but I just don't feel like struggling with that P word. I just don't. I really don't. Pramlintide, whatever. All right, so we got a what is 2, which is take your prescribed pills 1 hour before or 2 hours after the injection. We got a what is 4. We got another what is 4. Let's see what the answer is. Is it 4? Oh shit, it's 2. Good job, Unknown Beauty. All right, guys, it says pramlintide is used for clients with types 1 and 2 diabetes mellitus who use insulin. All right, it is administered subcutaneously before meals to lower blood glucose levels after meals, which leads to less fluctuation in the day and better long-term glucose control. So because pramlintide delays gastric emptying, any prescribed oral medication should be taken 1 hour before or 2 hours after injection of pramlintide, okay? Therefore, instructing the clients to take his or her pills 1 hour before or 2 hours after is correct. All right, they should not be taken at the same time as the other medications. It's given immediately before the meal in order to control the postprandial rise, which is after meals rise in blood glucose, not necessarily to prevent stomach upset. All right, it's incorrect to instruct the client to take the medication after eating, as it will literally not achieve its full therapeutic effect. Okay, so the answer is number 2, and that has to do with the fact that it delays gastric emptying. Okay, so because it delays gastric emptying, you want to make sure that any type of prescribed oral medication should be taken 1 hour before or 2 hours after the injection. All right, because of that delayed gastric emptying. All right, so it wasn't number 4 because it says make sure you take your pramlintide immediately after you eat, but that is incorrect because if you take it after instead of before, you won't get the therapeutic effect. Okay? So that was a good one. All right, are we good? We're good. Okay, great. All right, guys, awesome job. Let me go ahead and upload. Shut up. Don't say nothing. Don't say nothing. All right. Let me go ahead and put this into the app right now so y'all can play on the app for free for the rest of the questions. So let me go to it now. What are y'all saying? Okay. All right. So how did you guys enjoy that? So like I said, we are done with our session. Hold on. Wait, just one moment. Where did it go? Okay, got it. All right, so let me upload this literally right now. Okay. All right, guys, you should be able to play it. Why is this pissing me off? Okay, now we go. Okay, here we go. There we go. All right, guys, the new questions are up there. Haha. Wait, I spelled nursing wrong. 1 second. Nerding wrong? Nerding school? Okay, now we're good. All right, guys, if you download the NurseSam app, like I said, it's 100% free. And so are the Tease Tuesday and NCLEX Jeopardy games that I have there on the weekly ones that I have. This, today's questions, the ones that we're just doing, like I said, I've just been uploaded to the app. So you can go ahead and play these same questions and finish off this same game. Let me see. You find the questions if you in the app. So go to your Google, Android, Apple Store, whatever. Download the NurseSam app, 100% free, and then go to NCLEX Jeopardy or NCLEX Prep and play the NCLEX Jeopardy mobile game. So it's literally this exact same game that we played. It's new questions every week. We had 5 categories, 5 questions, 25 questions in total. 5 categories, 5 questions per category, 100 through the 500 points, blue screen, just like I showed you guys. And you guys can play that on your app, on the app, on the phone, anywhere, anytime. Like I said, 100% free. You get 25 new questions every week as a part of my NCLEX Jeopardy that I have to help you guys have fun and have fun studying. Okay, so I'm super excited that I was able to have this NCLEX Jeopardy live this week and not just have the online version. Thank you guys so much for helping with my nausea because it was unrelenting today. So I was actually finally able to get a little bit of a break. So I felt good enough to come and host this with you guys. I'm so happy because you guys always make this super fun and awesome. Yay. I'm so glad you guys enjoyed it. I'm so glad I was able to do it with you guys. Now, y'all know I love to do this weekly. So Tuesday, we're going to do the Tease Tuesday, the ATI Tease, the entrance exam. We're going to do that version on Tuesday for our Tease Tuesday. And then on Thursdays, we have our NCLEX Jeopardy Thursdays, as we always do. Okay, the only time that changes is if I'm sick or it's a holiday. Okay, so we are good for... Okay, good. Yeah, next week we're still good. It's the 23rd. It'll be the day before Christmas Eve. And the week after that will be the day before New Year's Eve. So we're good for the rest of the year. Okay, we're gonna have NCLEX Jeopardy on the 23rd and 30th. I'm bringing that new year. Okay, so make sure y'all join me next week, please, and download the NurseSam app. Go to your Google, Apple App Store, whatever. Type in the NurseSam, download the app, 100% free. Go to NCLEX Prep and play the NCLEX Jeopardy game. All right, guys, I will see y'all next time. If y'all have any questions, please let me know. I'm going to be answering my emails and going through my DMs and comments, responding back to you guys. What else? Like I said, it is the 3rd day of NCLEX. and it's $25 Ultimate Nursing School bundles. Okay, so it's regularly $97. Today it is $25. Okay, and like I said earlier, if you guys want to have that option to print, it's with every purchase of the Ultimate bundle. Okay, you will always get that option to print it for $85. That does not expire. That's not a that code does not expire. That link does not expire as long as you buy the Ultimate Nursing School bundle. In the email that delivers the links, and I'm going to change the email so it's a little bit more clear for you guys, you will get the link to print it if you would like it. Okay, it's $85 to print, about really $85 to print, especially if you use that code. Okay, if you don't use the code, it's like an extra $10 or $15. But like I said, I want to give you guys the cheapest and the best quality printing as possible, because Staples and Office Depot were tripping, talking about over $200 negative. So I found it for you guys for $85. Okay, and that's if you want to print it and bind it and have it delivered to you. Okay, $85. That's it. It's included with your purchase. The link to do so, and it's in the email that's titled "Your Ultimate Nursing School Bundle is here." Open me. All right, so that's it for tonight. $25 for the Ultimate Nursing School bundle versus $97. There's no code. It's automatically deducted when you check out. Yep, that's pretty much it. If you have any other questions, just hit me up. See y'all next week.